Hello, today I'm going to talk about what are clinical rotations and what are good clinical rotations. What are the things you should look for in clinical rotations when you choose them. Clinical rotations are also called as clerkships, and these are for medical students, usually done in the third year or the fourth year of their medical school curriculum, right? So these rotations, the clinical rotations, are training periods to gain hands-on direct patient care experience under a supervising practicing physician in US. That is what a clinical rotation is. Now, a lot of medical students apply for clinical rotations, and a lot of them apply from international areas: India, Pakistan, Bangladesh, Middle East, Africa, Europe, South America, Caribbean islands. They will apply for clinical rotations, and there is a hesitancy and apprehension in these students as to what a good clinical rotation is. So I'm going to tell you 6 or 7 characteristic features that you should look for when searching for a good clinical rotation. Number 1, they should be hands-on. Hands-on is a myth actually in the minds of IMG. They think hands-on meaning they'll be able to do thoracentesis, paracentesis, procedures. No. You are not going to be allowed to do any procedures in US. You can observe them. You can observe them when a resident is doing or an attending physician is doing, but you're not yourself allowed to do them. That's not hands-on. What hands-on means is you'll be able to interact with the patient, you'll be able to talk to the patient and their families, you'll be able to talk to the patient and take a history, do a physical exam, collect the labs, form an assessment and plan, present the case to the attending physician, and then arrive at a treatment plan, facilitate that treatment plan by conveying the orders to the nurse, making sure they are being done, get any investigations done, and follow up the patient next day or till the time the patient is discharged. That's what a hands-on means. So it's a myth that IMGs need to get cleared. Number 2, they should be hospital rotations, meaning predominantly hospital, at least 6 to 8 or 10 hours per week of hospital work. Maybe a lot of times it depends on the attending physician's schedule. They can have you come 2 times a week for 5 hours every day, or they may have spread it out over 3 days. So it depends on the attending physicians, but hospital exposure is very important because you would be spending 90% of your time in clinic when you are selected for a residency program on the floor. So that is very important. The third is the hospitals should be either university hospitals or university hospital affiliated places. They should be teaching places, teaching hospitals, academic medical centers. That is important. Number 4, the fourth thing is rotations are done for getting letter of recommendations, right? The letter of recommendations, not as much as the hospital letterhead is important, but who's writing the letter is important. The faculty should be teaching, they should be faculty people. Ideally, you should try to get it from chairmen, head of the departments, director of or section heads. So that faculty designation is important, not as much as the hospital letterhead. When somebody reads your LOR, they see who has written the letter. What is their faculty designation? So associate program director at such and such hospital. That is more important rather than the hospital letterhead. So number 5, what is the cost of the rotation? Make sure that the cost of the rotation includes application fee, processing fee, credentialing fee, physician's fee, hospital's fee, and most importantly, malpractice fee. You should not be exposed to doing a clinical rotation without a malpractice insurance. So make sure that all the costs are included. A lot of firms and organizations will shortchange you. This is an add-on, this is not included, so on and so forth. So be cognizant of that. Number 6, it is a business by a lot of doctors, independent practitioners, private practitioners. They do these kind of rotations. Be wary of that. Ask the hard questions. Am I going to the hospital or not? A lot of these physicians will take them just in the clinics and kind of a run-of-a-mill operation. Ask the hard questions. Am I going to the hospital? What am I going to be learning there? Am I going to be doing the history and physical, assessment and plan, so on and so forth? Ask all these hard questions. Ask if the application fee is included, processing fee is included, malpractice is included. Second thing is, most of these places, they have the offices which are run by secretaries, by nurses, or somebody with some medical background, and a lot of times they're not able to satisfy the students regarding their queries. Sometimes it takes them 6 or 7 days to convey the communication. So go with a setup that has physicians answering your questions. You will get meaningful reply. Response should be quick, within a couple of hours rather than over days and days together. Number 7, try to find rotations where your accommodation is close by. Firms or organizations that arrange that. 2 advantages in that. One is your experience is going to be good. It is going to be in close proximity. And number 3, you'll save $200 to $300 in transportation charges. I know students who commute 1.5 to 2 hours each way by buses, changing trains, so on and so forth. Don't put yourself through so much of grief. So these are the 7 things that you should check when checking a clinical rotation or searching for a good one. There are certain myths that I want to tell you today. One is, a lot of people are doing clinical rotations from Mayo, Stanford, Harvard, Yale, etc. Number 1, these are very expensive. They charge you anywhere from $3,000 to $5,000 per rotation, and usually they have a lot of students, and these are not even hands-on. You just rotate for a prestige letter, or a letterhead is all you are getting that letter for. It's better to do a rotation from a smaller academic center or university affiliate or hospital with a chairman, head of the department. That is more meaningful. Myth number 2, they want to do a rotation in New York, one in Chicago, one in Houston, one in LA. It doesn't matter. Geography doesn't matter. What matters is what you are doing the rotation, clinical rotation, and who you are doing that with. Those are the 2 important things. The third myth is, I need to get a letter of recommendation on the hospital letterhead. It is important to get a hospital letterhead, but a lot of times what the programs and the program directors see is who is writing the letter. Ordinary attending physician from a hospital letterhead is much less valuable than the chairman or the head of the department or the director of the section chief writing that letter on their own letterhead. So these are some of the pointers. I hope this helps you, and you can make good selections and be successful. Follow my videos on YouTube, connect with me on LinkedIn, Instagram. We'll be happy to help you. My name is Dr. Izhar, Izhar.